6 Common Habits That May Delay Pregnancy. Do you know that getting pregnant is not just about having sex? Have you ever wondered, while you are yet to achieve conception despite having an apparently good clinical and laboratory results from your fertility physician? Is it a surprise that you and your spouse are still expecting a positive pregnancy test result despite having sufficient sexual exposures for years? Then worry no more. MC Care Studio will bring you in this video 6 common habits that have been standing on between you and that desired pregnancy. Just hit the like button and give us your attention and let us show things you never put your mind on, because MC Care truly cares. Several factors, single or a combination, contribute to your not getting pregnant. We will help you understand these factors and improve your conception rates by offering solutions on way forward. But first, let's look at this question: how long does it take to be pregnant? According to the statistics presented in the research before your pregnancy by Amy Ogle and Lisa Mazzullo, you have a 25% probability of becoming pregnant during every menstrual cycle when you are healthy and your reproductive parts are functioning at their best. 30% will conceive within the initial month, first cycle, 75% will conceive after 6 months, 85% will conceive within 1 year, 12 cycles, 90% will conceive after 1 year, while 95% will conceive after 2 years. While your periods may be regular, these 6 common habits can affect your chances of conception. Counting down from the 6th. Stress. Believe it or not, our bodies are equipped to prevent conception from occurring during times of extreme stress. Researchers have made it clear that stress boosts levels of stress hormones, such as adrenaline, catecholamines and cortisol, which can inhibit the release of the body's main hormone, GnRH, gonadotropin-releasing hormone, which is responsible for the release of sex hormones. Subsequently, this may suppress ovulation in women, reduce sperm count in men. Chronic stress may cause lack of libido as well as a decrease in general fertility. Stress-induced reproductive dysfunction has become such a common issue, but unfortunately is least considered by couples seeking pregnancy. Trying to carry a pregnancy to term during stressful times places the fetus at risk. The body perfectly understands this, which is why it creates an environment that is basically inhospitable to conception. Generally, a stressed person is an unhealthy person. People living with a high stress level are typically overly tired and filled with nervous tension, which may cause them to choose poor dietary and lifestyle habits. What to do? Make sure you are getting enough sleep. Get an adequate amount of healthy exercise daily. Relax and meditate. Start practicing yoga. Seek counseling. Consume natural food and herbs with good content of antioxidants and supplements. Reading a book in the park. If your job is really stressful, maybe begin to look for a different job or occupation. Take warm baths. Surrender and let go. Change how you react to stressful situations. Develop a habit that helps you to reduce stress. Number 5. Sleep deprivation. Surprised? You don't have to be. Lack of sleep can affect fertility-related hormones. In both men and women, the same part of the brain that regulates sleep-wake hormones, such as melatonin and cortisol, also triggers a daily release of reproductive hormones. The hormones that trigger ovulation in women and the sperm maturation process in men may be tied into the body's sleep-wake patterns. For example, if you're a woman, long-term lack of sleep may directly affect the release of luteinizing hormone, LH, the hormone that triggers ovulation as part of regulating your menstrual cycle. The resulting menstrual irregularity may mean it takes longer for you to conceive. A recent research showed that women undergoing in vitro fertilization (IVF) who scored 7 to 8 hours of sleep a night were 25% more likely to become pregnant than those who snoozed for 9 hours or more. The extra sleep is possibly linked to other behaviors that can impact fertility. On the other hand, too little sleep can also hurt your chances of becoming pregnant. Women having IVF who racked up fewer than 7 hours of sleep nightly were 15% less likely to conceive than those who hit the sweet spot of 7 to 8 hours. What to do? Honor your personal sleep needs. Don't work odd hours if you can help it. Keep your sleep and wake time consistent. Stay away from melatonin supplements. Although it's tempting to self-treat insomnia or jet lag with melatonin supplements, it's not a good idea for any man or woman who is trying to conceive. Be honest about sleep disorders and seek help promptly. Number 4. Being overweight or unusually thin. According to William Schlaff, MD, Chairman Department of Obstetrics and Gynecology at Jefferson Medical College, Thomas Jefferson University, Philadelphia. The more weight a woman gains over her healthy weight, the more she tends to experience decreased ovarian function. Carrying around extra pounds can affect hormone production and make it more difficult for a woman to get pregnant. A 2009 study on fertility and sterility found that women who were obese at age 18 were more likely to develop polycystic ovary syndrome, PCOS, and have problems with infertility. PCOS is the most common hormonal disorder among women of reproductive age and the leading cause of infertility. Just as excess body fat can impact fertility, so can not having enough of it. A 2009 Harvard University study revealed that having low leptin contributes to the absence of ovulation and menstrual periods. Coincidentally, women who have very low BMIs are deficient in leptin, the hormone that controls hunger and feelings of satiety. What to do? Maintaining a healthy body weight, one that falls within the normal BMI range, is one of the most important things a woman can do to increase her chances of getting pregnant. This can be reached through a healthy diet and moderate exercise. Number 3. Lifestyle such as chronic smoking, drinking, and drugs. The ugly thing about smoking is that both inactive and passive smokers are almost equally affected. Women who smoke or are exposed to other people smoke, passive smoking, have an increased risk of infertility and are more likely to take longer to get pregnant. In fact, passive smoking is only slightly less harmful to fertility than active smoking. Similarly, there's strong scientific evidence that alcohol can reduce fertility in both men and women. However, according to Dr. Anthony Rutherford, a consultant in reproductive medicine and chair of the British Fertility Society, how alcohol makes women less fertile is still poorly understood. A review of observational studies on smoking and semen parameters found that 20 of the 25 studies reported an increased risk of lower sperm concentration in smokers compared to non-smokers. On average, sperm concentration was 13% lower in smokers compared to non-smokers. Smoking men also had a lower average proportion of sperm that was model and morphologically normal compared to non-smoking men. Drugs, tobacco, and alcohol all have a range of effects detrimental to the production of sperm. These effects include reduced concentrations of sperm in the semen and reduced concentrations of sperm which have a normal shape and are able to move or swim. What to do? The good news is, many of the drugs that affect sperm health are lifestyle drugs, that is, drugs taken for recreation rather than medical purposes. As such, there is a range of lifestyle modifications individuals can make in the interests of maintaining sperm health. This will include stopping smoking, minimizing alcohol consumption, avoiding anabolic steroids and other performance-enhancing drugs, and avoiding marijuana, cocaine and other recreational drugs. Number 2. Poor nutrition. Underweight and, to a larger degree, overweight and/or obesity are related to the enhanced risk of infertility. Insulin resistance is an important pathogenic mechanism that may impair ovulation. Adequate intake of monounsaturated fatty acids, derived mainly from vegetable fats, as well as avoidance of transisomers of unsaturated fatty acids which are present in industrially produced cakes and sweets, crisps, fast foods, powdered soups and hard margarine, may be effective in the prevention of infertility in females. Choice of plant rather than animal sources of proteins, decreasing glycemic load of the diet, use of dietary supplements containing iron and folic acid could also be beneficial. Avoidance of vitamin B12 deficiency and its supplementation seem to be important in the prevention of early miscarriages. Sufficient intake of antioxidants also promotes female reproductive functions. Accumulation of free radicals plays an important role in the development of male factor infertility. It was shown that proper intake or supplementation with antioxidants may be effective in its prevention and treatment. Such nutrients as zinc, selenium and folic acid act beneficially on sperm quality. A well-balanced diet seems to play an important role in the prevention of infertility in both sexes. Number 1. Too much or too little sex. Sex is obviously the most basic human need for pleasure and reproduction. Unfortunately, people are always in the extremes, either getting too little or having it excessively. Some people believe that having more sex could lead to conception. But this may not always be true. Though frequent sex will not decrease the vigor of a man's sperm, it can cause potential health problems such as fatigue, dizziness, weakness. If you indulge in a lot of sex only to have babies, it could lead to burnout. In this case, when the actual fertile window is open, either partner may not be interested in sex. And, as a result, you lose an opportunity to conceive. On the flip side, you may be cutting down on intercourse to save the sperm, or you only have sex during ovulation. But staying without sex for many days may affect your conception. You could miss your fertile phase when sex is limited, as you may not always be correct about your ovulation. What to do? Try to have sex frequently and at the calculated time by keeping a close watch on your ovulation dates. If you have problems tracking your fertile window as a result of irregular periods, use an ovulation kit. If the results shows that ovulation is due in 1 or 2 days, have sex during that time. Keep in mind not to have sex just for having a baby, because then you can't enjoy the process. Now, which of these habits are you currently fighting? Share your experience and suggestions at the comment section. Don't forget to like, share and subscribe.